This is Brad with Dr. Brian Thomason's office. We're here today with Jim Ellett. Jim, how long have you been under care by Dr. Thomason now?
I saw him 2 weeks ago with my first appointment.
Great. And why did you originally come to see him?
I came because I have type 2 diabetes. I've had it for about 5 years, and my last two tests at Kaiser, my A1Cs was 8.6 and 8.1, which is just off the scale.
Yeah.
So they had me on metformin, they upped my metformin, and I take 5 pills a day of 500 milligrams, 2 in the morning and 3 at night, so I take 2,500 milligrams of metformin. They can't give me any higher than that. They have to go on some other nasty drugs to get the sugar down. So I came to see Thomason because I don't want to go on the other drugs with side effects.
And so you've been on the program for 2 weeks now. How has it been working for you?
Well, the second week, I went off all my metformin. I'm not taking any metformin.
Whoa.
My blood sugar, fasting blood sugar, is now ranging between 120 and 130 without the pills. So it's like a miracle. I thought it would take years to get off those drugs. So, and I'm feeling better, and the program's working like a miracle.
Great. And have you noticed any other changes?
I've lost about 15 pounds in weight just in the 2 weeks, and I'm not trying to diet. I exercise and eat right the way he said to eat, and I just lost the weight without even doing anything else.
Great. And would you recommend his program to other people?
Anyone that has diabetes needs to come and see this gentleman. I mean, if you want to get rid of the diabetes without taking all these drugs with all these side effects and stuff, you need to come see Dr. Thomason. It's a miracle for me. It works for me.
Great. Thank you very much, Jim.
Thank you.
Hi, I'm Dr. Brian Thomason, and if you're watching this video, it's likely that you or someone that you love or care about is suffering with type 2 diabetes, metabolic syndrome, prediabetes, hypoglycemia, syndrome X, or some other form of what is known as dysglycemia. The definition of dysglycemia is abnormal blood glucose levels from any cause that contribute to disease. The main focus of this video will be on understanding the underlying causes of dysglycemia, including type 2 diabetes, and what it takes for your body to regain its ability to balance and regulate normal healthy blood sugar levels naturally. The information that you're about to hear in this video is most likely nothing that you've heard before and should greatly expand your understanding of your body's metabolic processes and ability to naturally regulate its own blood sugars. You will most likely learn more in the next 20 to 30 minutes about type 2 diabetes, dysglycemia, and their underlying causes than you have in your entire lifetime. And if you're like most people with type 2 diabetes in the United States, you've been offered very little explanation about the underlying causes and or dysfunction, or how to improve and restore your body's ability to normalize blood sugar levels naturally. You may have initially been given a vague suggestion to exercise more and improve your diet, and when that has failed, as it most often does, without very specific direction and some understanding of underlying cause, you were probably only offered a pharmaceutical approach as a solution for it. Well, this one-size-fits-all approach, where the underlying causes are largely left unaddressed, is, in my opinion, one reason that diabetes has become the number 6 leading cause of death in the United States today, and why so many with dysglycemia suffer quality of life changes which can actually be prevented and reversed. So I offer you this. Sit back, relax, and enjoy the information presented in the next 20 to 30 minutes. If concepts are not quite clear the first time, since this is video, remember that you can pause, rewind, and listen as many times as it takes for you to get an understanding. Okay, so let's start with a very basic question. What is diabetes? Now, you have probably heard a few terms like prediabetes, syndrome X, metabolic syndrome, and insulin resistance, even diabetes, without understanding their exact meaning or definition. The first thing that I want to point out is that diabetes is a diagnosis. The label diabetes doesn't provide any information or understanding about the underlying cause or causes. It is simply a definition. Diabetes is defined as a fasting blood glucose reading of 127 measured on 2 separate occasions or more. So what is so significant about this number 127? What's going on with the body at 126? Is a person with a reading of 126 considered healthy where a person at 127 is unhealthy? Is any harm being done to the body at level, let's say 125 or 124? Do we have any influence over these numbers? And if so, how specifically can we change these numbers? Another great question to ask is what numbers or ranges reflect optimum health and function? To further understand, let's take a look at some of these blood glucose numbers and their corresponding definitions. Okay, the first range that we will look at is a lab range that would be considered normal by many doctors in the HMO-PPO environment. I would like to point out that lab ranges, and this one in particular, are very wide ranges, and they are designed to test for pathology and disease once they have already occurred. Lab ranges are not designed to measure optimum levels. So the lab range we see here spans from a low of 65 on up to a high of 105. Prediabetes is defined as between 106 and 126. And as stated before, diabetes is defined as a fasting blood glucose reading of 127 or above, again tested on 2 separate occasions. The last range that we will take a look at is considered a functional range, which I will refer to later on in the information. The functional range or optimum range of fasting blood glucose is a level between 85 and 99. Okay, so let's go back to the questions that we asked previously. What is significant about this number 127? What is the difference between a glucose reading of 127 and 126? What is the difference between prediabetes and full-blown type 2 diabetes? Functionally speaking, there may be little to no difference. The same damaging inflammatory processes occurring at a level of 127 are also occurring at a fasting glucose level of 126 and 120 and 110. There are even experts who acknowledge inflammatory damage throughout the body at fasting levels of 100. One thing that I find that most people agree on is this. It is far better to learn exactly what lifestyle changes can be made and implement them early as compared to waiting until your blood sugar levels are so high that the first recommendation is medication. What if you could find a doctor who took this approach? One that instead of waiting until you were so deep into a disease process before recommending you take action, instead focused on understanding and achieving optimum functional ranges today. How valuable would it be if your doctor began looking for dysfunction that occurred just 1 point below or above the optimum level and gave you both clear and specific instructions designed to return fasting blood glucose levels to the optimum ranges, which are between 85 and 99? Well, what I just described is exactly our approach, and we see consistent results with our patients whether they have glucose numbers of 101 or 534. So hopefully you can begin to see the benefit of thinking about blood sugar ranges as a spectrum which you have a large influence over, and that your glucose reading is not just some stationary number on a lab test result that sentences you to a diagnosis that you're stuck with for the rest of your life. Okay, let's continue by understanding the basics of how a body with good metabolic function maintains blood sugar within optimum healthy ranges. Here we see a cell with an adjacent blood supply, a few molecules of blood glucose, and a few structures embedded within the cell membrane. These structures are an insulin receptor and 2 glucose transport proteins. As we digest a meal, foods are broken down in the stomach. Glucose is then absorbed through the small intestine into the blood. When blood glucose levels rise, this signals the pancreas to manufacture a hormone called insulin and secrete it into the bloodstream. As insulin levels rise, they begin to interact with insulin receptors by binding to the exposed surface structures. Provided that insulin receptors are healthy, this binding of insulin will trigger a message inside of the cell to the glucose transport proteins, which will open and allow entry of the available glucose in the bloodstream into the cell. Through this action, blood glucose levels are obviously reduced to normal levels, and this is how balance is maintained. Once the glucose enters the cell, it is processed into ATP, which is our body's energy currency. ATP is required to drive all bodily functions and processes. So based on what we just saw, we can understand how the body maintains and balances normal healthy blood sugar levels. In regards to type 2 diabetes, the most widely published cause underlying type 2 diabetes is known as insulin resistance. Let's take a closer look at what exactly goes wrong. Looking at a similar animation, we can again identify a cell with an adjacent blood supply, a few glucose molecules, 2 glucose transport proteins, and the insulin receptor, which in this scenario will not be functioning properly. Again, as we digest a meal, foods are broken down in the stomach. Glucose is then absorbed through the small intestine into the blood, and we see blood glucose levels rise. Elevated blood glucose will signal the pancreas to manufacture insulin and secrete it into the bloodstream. As insulin levels rise, they begin to interact with insulin receptors by binding to the exposed surface structures. When an insulin receptor becomes resistant, it will often respond once activated by sending a weak or an abbreviated signal, or sometimes not respond at all. In this case, we observe the receptor giving no response at all. With no response, the glucose transport proteins remain closed and available blood glucose cannot enter into the cell. At this point, additional glucose from the meal that was just consumed continues to be absorbed into the bloodstream, resulting in an even higher concentration of blood glucose. This, of course, stimulates further insulin secretion from the pancreas, and we again see insulin levels rise in the bloodstream. As insulin levels reach higher concentration, more interaction will occur with the insulin receptors. And as you can see, as in this case, the resistant receptor will give a weak or an abbreviated response to the glucose transport protein. This weak or abbreviated signal results in allowing much less glucose into the cell. Although perhaps enough glucose gets into the cell to maintain basic bodily functions, this is not optimum. When blood glucose levels rise above normal levels, it causes more insulin to be released into the blood, resulting in abnormal serum levels of insulin, and high levels of circulating insulin are inflammatory. That means more tissue damage. This is the result of insulin resistance. There are several factors that can influence and cause insulin receptors to become resistant and less sensitive. And within this functional approach to care, we systematically prioritize and address each probable cause based on tests. And then we improve function in order to reverse insulin resistance. And yes, insulin resistance is reversible. Obesity can be both a cause and an effect of insulin resistance. If you have high blood sugar levels and you've found it near impossible to lose weight, there's most likely a very specific reason why. It's a process called lipogenesis, and it occurs when blood glucose levels are elevated. The body will normally store reserves of energy both in the liver and the muscle tissue throughout the day, and those stores can only hold so much. Once the stores get full, guess what happens to the excess glucose in a person with diabetes or dysglycemia? Excess glucose in the blood will be transformed into fat, more specifically belly fat. If you are like many with diabetes or dysglycemia who get the vague recommendation by your doctor to lose weight, you've probably gone through some pretty deep frustration. It's virtually impossible for a person who is in lipogenesis to lose weight, even on a low-calorie diet, and very specific steps have to be taken in order for a person to exit a state of lipogenesis. Once out of lipogenesis, weight loss can happen without further effort. You've probably heard from your doctor that in order for you to be healthy, you need to lose weight. Well, in reality, you need to become healthy, and then weight loss happens. From what I observe within the current HMO/PPO environment of care, lipogenesis is not even addressed, let alone explained to a patient with diabetes. Yet this remains a key in reaching a healthy body fat level. Listen to one of the most recent discoveries that has been made regarding fat tissue. If you're like me, you'll be amazed. Up until recently, fat was considered to be an inert tissue with no biological activity. The idea was that it was just there. It didn't do much other than store excess energy. We now know that fat tissue is a metabolically active endocrine organ that secretes hormones and inflammatory cytokines such as interleukin-6 and tissue necrosing alpha. The metabolic activity of fat is key to understanding its role in type 2 diabetes. In other words, we've discovered that fat tissue is a source of active inflammation as well as harmful immune system cytokines, and we know that excess inflammation throughout the body is not healthy, it's damaging. In fact, virtually all pain comes from inflammation. With diabetes and dysglycemia, there's a term that is used to accurately describe the most devastating characteristic of this condition. It's silent inflammation. What is silent inflammation and why is it so harmful? Silent inflammation is simply inflammation that you do not feel, yet it still causes damage. The vast majority of complications from diabetes are a direct result of inflammation. So in summary, we now understand that fat tissue is a source of active inflammation as well as harmful immune system cytokines. Other factors which may underlie your dysglycemia include diet, specifically regarding fats. A disappropriate intake of omega-3s, 6s, and 9s can increase insulin resistance. An improper balance of or incorrect timing of your protein and carbohydrate intake throughout the day. Low-fat. I'd like to talk about the liver and its role in dysglycemia. Since the liver is one of the main tissues the body uses to store glucose, a healthy functioning liver with active chemical pathways for detoxification is vital to maintain proper blood sugar balance. This makes complete sense, again, based on the fact that significant amounts of glucose are stored in the liver as glycogen, which must be liberated back into the blood as glucose when blood glucose levels are low, during sleep, for example. Recent research out of Stanford University has linked fatty liver, estimated to be present in about 1/3 of the U.S. population, as a significant contributor to type 2 diabetes. Within the degrees and types of non-alcoholic fatty liver disease, simple fatty accumulation is not considered to be highly dangerous in and of itself, although it can lead to excess weight and diabetes. This, in my opinion, describes the general attitude of healthcare practitioners within the HMO-PPO environment towards the relationship between liver and type 2 diabetes. The idea is that it's not very dangerous, so why look into it? There's no specific medication we can give for that. Just tell the patient to go on a low-fat diet. Based on the histories taken in my office of patients with type 2 diabetes, within the HMO-PPO environment, the liver is most often completely overlooked as a causative factor regarding blood sugar imbalance and diabetes. There are several tests beyond liver enzymes that can indicate whether a person would benefit from a liver detoxification process or not. And your doctor simply may be unaware of or may just not be trained to recognize liver function as important when evaluating blood sugar imbalances. When we see indications of liver dysfunction in a patient with diabetes, from a functional approach, many choices exist for a patient to detoxify the liver and improve the liver detoxification process. In order for your body to regain its ability to balance blood sugar naturally, you have got to stop destroying your liver and work on returning it to normal, healthy function by restoring its ability to detoxify. Remember that the liver is vital in the release and storage of glucose, otherwise known as gluconeogenesis. If your current doctor is not including your liver as a piece of your diabetes puzzle, how can you ever expect to be made whole again? The next underlying cause that I will talk about is a condition which involves your barrier system. There is a system which current research has now tied to type 2 diabetes. It is actually where up to 80% of your immune system activity takes place, and it is also one of the most overlooked systems within the HMO-PPO environment in the assessment of type 2 diabetes. It is your gut. If you have heard of leaky gut syndrome, but have been told by your doctor that it does not exist, think again. The most recent studies now support leaky gut as being a necessary component to type 2 diabetes. In other words, research suggests that you cannot have type 2 diabetes unless you first have leaky gut syndrome. If you're familiar with leaky gut syndrome, or another name for that is intestinal permeability, after learning that it is a prerequisite to reach the state of diabetes, you'll probably have two questions at this point. One, can you test for leaky gut? And 2, can leaky gut syndrome be repaired? The answers to both of these questions are yes. Both are a part of a functional approach to patients with type 2 diabetes in our program to restore blood sugar balance naturally. If you've not heard of leaky gut syndrome before, this should be helpful to you. Okay, so I want to give you a perspective of where and how leaky gut occurs, and identifying some structures should help you with that understanding. The outer layer, or the ring of black cells, represent enterocytes, which are the barrier between the contents of your small intestines and your blood supply. Wrapped on the outside of our small intestines are blood and lymph vessels, which is where our nutrition is absorbed from the food that we eat after it is broken down properly. So here we're looking at a zoomed in perspective of a cross section of the small intestines. And here we see a row of enterocytes, and for orientation purposes, on this side of the barrier we're looking at the lumen, or the inside of the small intestines, and on this side we're looking at the blood supply in the form of a blood vessel, and this is outside of the small intestines. Now, one of the most important structures relating to the function of this barrier system are what I have labeled here as tight junctions. And these tight junctions are actually special proteins called zonulin, which not only assist in holding these enterocyte cells together, but they actually create a very specific allowance, or a small space, a filter, if you will, which only allow molecules that are small enough to pass through into the blood supply. When this barrier system is healthy and functioning correctly, it will keep everything out of the blood supply except for nutrition. And even nutrition won't get through until it's properly broken down to an appropriate size, where it can then be passed from the small intestines through this channel into the bloodstream as nutrition or nourishment. So things like bacteria, viruses, and toxins that make their way into the small intestines, they will also not break through this barrier and enter the blood supply. And the mechanism largely is that these molecules of the bacteria, viruses, and toxins are too big. They won't pass through this limited channel here. And whatever's not allowed through into the blood supply is going to be carried out of our body as fecal waste. Now, food will enter into the small intestines in the basic forms of proteins, fats, and carbohydrates. And proteins, fats, and carbohydrates in the form that we see here should not be in the blood vessels. Fats will have to be broken down first into fatty acids before they'll pass through into the bloodstream. Proteins will have to be broken down into amino acids and peptides, and carbohydrates will not pass through until they're broken down into simple sugars. Now, leaky gut syndrome occurs when these tight junctions are disassociated or degraded, and that creates that channel, which is normally really tight, to open up to abnormal sizes and allows food to enter or leak into the bloodstream prematurely. So what are the consequences of proteins, fats, and carbohydrates getting through this channel and being found in the bloodstream? Well, although the full look into that topic is beyond the scope of this video, I will give you an overview of the description. The consequences largely affect the immune system. That's the system that's responsible for cleaning up the inappropriate placed molecules in the blood vessel. So the proteins, fats, and carbohydrates, which would normally be seen and recognized as nutrition for the body, are now seen by the immune system as foreign invaders, and they're handled as poisons. Now remember, if a person has leaky gut syndrome, this is occurring each and every time they eat a meal. One of the damaging consequences of immune system overactivity is both local and systemic inflammation, which has devastating consequences of its own over time. And remember, with open channels from the small intestines into the blood supply, not only inappropriate food gets through, but now bacteria, viruses, and toxins further add to the load that the immune system is already burdened with in leaky gut syndrome. So this leaky gut syndrome has been linked to multiple degenerative conditions, including liver damage, diabetes, and it's thought to be a heavy role in the development of all autoimmune diseases. There are two things necessary to resolve this condition. One is you need to stop destroying your intestinal barrier by identifying certain foods that are antigenic to you and removing them from your diet. And the second is to nutritionally supply the cofactors needed for the proteins that make up these cell junctions to reintegrate and heal. When we are successful at reintegrating the intestinal barrier, healing leaky gut syndrome, we see great results towards the restoration of a person's ability to reestablish balanced and healthy blood sugar levels naturally. So as you can begin to see, the current standard pharmaceutical approach as a solution to dysglycemia or type 2 diabetes simply ignores the vital relationship that your blood sugar has to the organs and the systems which you can balance and improve by improving your habits in the area of nutrition, supplementation, exercise, once these areas of dysfunction are identified. I would like to close with these words. In the 18 years that I've been in practice, I've seen an epidemic increase in the number of chronic degenerative conditions in the United States, type 2 diabetes being among them, and a profit-driven HMO PPO healthcare system that overwhelmingly fails at any attempt to actually restore a patient's health, but instead seems to be satisfied at merely managing a person in a diseased state as the disease progresses. Recognizing this unanswered need for people with chronic health problems has directed my interest, my clinical focus, and my ongoing postdoctorate education to these areas: functional blood chemistry analysis, functional neurology, metabolic thyroid function, metabolic endocrine function, neurotransmitters, and functional nutrition. These are active areas of my continuing education process, which I currently pursue even today. Staying current with recent research and an ongoing education process are fundamental to achieving the level of success that we, my patients and I, reliably experience in practice week in and week out in the area of restoring blood sugar balance. If the information that you just heard makes sense to you, I encourage you to find a healthcare practitioner in your area who takes a functional approach to your health and make an appointment with them. Again, in order to bring about positive changes in your health, you must be willing to take action. I'm Dr. Brian Thomason. It has been my great pleasure to share this perspective on health with you. It is my sincere desire to see you in abundant health.